Points to remember. For children, depth of compressions should be at least 1/3 of the anterior, posterior diameter of the chest, approximately 5 cm. For infants, depth of compressions should be at least 1/3 of the anterior posterior diameter of the chest, approximately 4 cm. CBLS with the presence of 2 responders. First 2 responders for an adult.
Sir, are you okay? You okay? Code blue, bathroom! Code blue, bathroom!
Check pulse for no more than 10 seconds.
Hi, how can I help you? Airway, please, thank you. 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4. 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, yeah, 30.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30.
1, 2.
Second 2 responders for children. Step 1. Check responsiveness. Shake and shout. Step 2. Call for help. Alert for code blue. Step 3. Check pulse for no more than 10 seconds. Step 4. Give 15 compressions. Step 5. Open airway and give 2 breaths.
Choking. Choking in adults. Signs of choking. Poor or no air exchange. Weak ineffective cough or no cough at all. High-pitched noise while inhaling or no noise at all. Increased respiratory difficulty. Possible cyanosis, turning blue. Unable to speak. Clutching the neck with the thumb and fingers, making the universal sign of choking. Unable to move air. What to do if you see someone choking? Heimlich maneuver. Step 1. Ask the victim if he is choking, and if you can help him. If the victim nods yes, and can talk, act quickly. Tell the victim you know what to do, and you are going to help him. Step 2. Stand or kneel behind the victim, and wrap your arms around the victim's waist. Step 3. Make a fist with one hand. Place the thumb side of your fist against the victim's abdomen in the midline, slightly above the navel and well below the breastbone. Stand behind the victim with your legs separated. Place one of your legs between his or her legs. Establish a firm footing base to support the patient, and prevent him from falling when he or she becomes unconscious. Step 4. Grasp your fist with your other hand and press your fist into the victim's abdomen with a quick inward and upward thrust.
Are you okay? Are you joking? Can I help you? Okay.
Repeat thrusts until the object is expelled from the airway or the victim becomes unresponsive. If the victim becomes unconscious, lower him to the ground slowly. It may be necessary to repeat the thrust several times to clear the airway. Give each new thrust with a separate distinct movement to relieve the obstruction.
Choking in children.
Child. 1-year-old and above. Administer abdominal thrusts until object is dislodged, or child becomes unconscious. If the child becomes unconscious, call for help and begin CPR, starting with compressions. Commence 30 to 2 compressions to breaths ratio. With one extra step, each time you open the airway, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, remove it.
Infant, less than 1 year old. Administer 5 back blows followed by 5 chest thrusts, until obstruction is dislodged, or infant becomes unconscious.
Five back blows. Five back blows followed by 5 chest thrusts. If the infant becomes unconscious, call for help and begin CPR, starting with compressions. Commence 30 to 2 compressions to breaths ratio. With one extra step, each time you open the airway, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, remove it.
Summary of CBLS.
Allow complete gastric oil between compressions. Minimize interruptions in chest compressions. Attempt to limit interruptions to less than 10 seconds. Head tilt, chin lift. Suspected trauma, jaw thrust. Compression to ventilation ratio, 30 to 2. Compression rate, at least 100 per minute, deliver 30 compressions in 18 seconds or less. Depth of compressions. Adults, at least 5 centimeters. Children, at least 1/3 of the anterior, posterior diameter of the chest, approximately 5 centimeters. Infants, at least 1/3 of the anterior, posterior diameter of the chest, approximately 4 centimeters. Choking, adults and children, Heimlich maneuver. Infants, 5 back blows, 5 chest thrusts. Call for help at the beginning.
Attention, after watching this video, answer the pre-test and bring it with you to the CBLS class. Note that you will not be accepted in the class without the pre-test. Thank you for watching.